Hello everyone, my name's Tim. I'm one of the founders of Protein Rebel, and we're here with Dr. Juliet to talk about bone injuries, which are actually surprisingly common with runners. So let me just read out a stat that I found. So half of regular runners get injured each year, and bone stress injuries account for 30% of all running related injuries. So it's a really important issue. And so it's really good that we've got Juliet here. So give us an insight in what they are and how actually people get them when they're running.
Definitely. The first thing I want to say is that running is really great for bones.
Right.
Because we kind of think, oh, there's injuries, oh gosh, we better not run. But running is a real gift to bones because it helps them to get stronger. But there is always a little bit of a tipping point with too much of a good thing. And we can, if we're not careful, get some bone-related injuries. Obviously, we have fractures if we are tripping, falling, accidents, etc. But we also have some injuries to bones which are related to overrunning or overuse. And they are things like shin splints, and stress fractures. And those two, I would say, are the kind of the main things we're thinking about with bony injuries in runners.
Oh, right, okay. So what are actually shin splints and stress fractures? Maybe we should kind of clarify that first of all.
I wish for shin splints I could give you an easy answer, but the truth of that is that we don't actually really know what's going on. Right. Lots of studies have looked at them and done all sorts of scans and things.
So is it like more of a feeling? Is it an actual physical thing?
Yeah, it's a physical thing, but can't quite pinpoint exactly what it is that causes the pain. One of the main theories is that it's some bleeding in between the outer layer of the bone, the periosteum, and where the muscles attach.
Right, okay.
So it's usually quite a diffuse sort of area, quite commonly around the inside of the shins.
I always kind of think somewhere like there, somewhere, you know.
And that's sort of somewhere like their description is quite typical of a shin splint. Whereas a stress fracture is actually a crack that forms in the bone. And usually rather than kind of that rough area, you can pinpoint an exact point.
It's there.
And it's quite tender, or it can be tender. And the main areas that can happen in runners is in your feet, in your shins, also in your knees, your pelvis, and sometimes in your hips. So basically, lots of the leg bones.
Oh, okay. And what's kind of causing that then?
Yeah, so as I said at the beginning, running is great for bones because bones love a bit of stress. When you put a bit of pressure on them and you stress them and test them, they respond by getting stronger. But in order to do that, they need time to recover and repair and reinforce themselves. So if there's a bit of a mismatch, if you're doing an awful lot, excessive miles, particularly if you're building up really quickly, or you're not giving your bones enough recovery time, then you can put them in the position where they're a bit overstressed, and then that can make them more likely to fracture. Right,
okay, so that's a couple of kind of interesting points then, really. So is there like a specific amount of time, or does it always depend? Is it different between men and women? And what's causing it? Is it like running on pavements, on hard things, for example? Or are you better off running on trails, which is softer? Or is it hills, or doesn't it matter?
Yeah. I think with any injury, it's always important to think there's not always one thing that causes it. Injuries are always caused by a multiple of factors. So it could be things like your training, the way you're building up in your running. It could be to do with your nutrition. It could be to do with your hormonal status. It could be to do with your biomechanics, your posture, how your joints
go. Where you trainers, for example.
More things like the way joints are designed to move in a certain way, and bone stress can alter if the angles of joints change. So if you've got an old injury, for example, or you've got a muscular sort of imbalance or weakness which causes your posture to be a little bit out of alignment, then that can put undue stress on one area of a joint, perhaps not quite in the way that it was designed to. So all of those factors can lead you to bony injury. You mentioned, are women more likely to get it? The stats show that they are a little bit, and again, it's probably to do with lots of those different factors, perhaps to do with bony alignment, with women's pelvises being a little bit wider, perhaps to do with hormonal factors, and the fact that women are more likely to experience osteopenia and osteoporosis, conditions where you have less than normal bone mass, which makes bones more likely to fracture. So we do see in the stats that women do tend to suffer from bone injuries a little bit more, but also more common in beginner runners and inexperienced runners as well.
What, so where people are trying to do too much too early? Is that kind of it?
Yeah, exactly that. Yeah, exactly that. Just not allowing and not really understanding how much recovery time those bones need to repair, and ramping up so quickly in the miles that the bones just haven't had time to adjust and reinforce and to build up to the strength they need.
Oh, okay. So, how much time generally would you need to kind of go from 0 to, I don't know, let's say not hero, but consistent running then?
Varies, really does vary, person to person. There's no set rule, and also varies with age as well. And we do know that older runners need a little bit more recovery time, so you need to build in more rest days. If you're starting from 0 and you're a beginner runner, then I wouldn't start running every day. You hear about people doing run streaks and running, for 1,000 days without having a break. For some people that works, that's fine. But particularly as a new runner, I would start with kind of 3 days a week, say, and giving yourself plenty of time for the bones to sort of start realising what's going on and to adjust. And you can gradually sort of build up from there.
So does actually the distance make any difference?
Yeah, it will do, because the longer you go, the more stress you're putting on the bones there. So always important to just increase gradually. And they say the 10% rule, don't they? Adding 10% to your distance sort of over the weeks. But I think also as well putting in some easier weeks so that you're not constantly up. After 4 weeks or so, you just maybe have an easier week and then give yourself the best chance.
Yeah, so I mean, I know with muscles, it's all about actually putting in intensive effort and then coming down again, and that's how you build up the muscle fibres. Is it the same idea with kind of bones as well, to kind of strengthen them?
Yeah, I think so. I mean, I think it is just about being sensible really as well. And one thing I didn't mention before was that if you're feeling a niggle, to not ignore it.
We all do that.
Yeah, because something that's in your shin, maybe a couple of days rest and it'll go away. Whereas if you keep going and going and going, so yes, increase your distance. Yes, follow the 10% rule, but also just bear in mind that you might need to take an easier time when you're not expecting to, just because something starts twinging a little bit.
Yeah, I mean with shin sprints particularly, I found that they take a long time to go. It's not, for me personally, it's not just a couple of days. It can be quite a few weeks, really. Is that common? Am I like everyone else?
Yeah, you are. You're normal. Yeah, and to be fair, it's much better to take a few weeks out and get better than it is to just keep going and going, because potentially you could, if there is bone stress, it could turn into a stress fracture if you don't do that, or it may just take longer and longer, and you'll be out for longer in the long run.
So when you're pounding the pavements, is it the fact that you're running on the hard surface that's causing the potential for bone stress, or is it just the act of running?
I think impact is important, and as I say, impact can be a good thing because it does put stress on the bones, but too much impact can potentially increase your risk. Now, I prefer running on the road. That I just like to I don't know, when I put my foot down, it's going to stay where it is. But I think if we're thinking about looking after our bone and our joint health generally, then it is a good idea to mix it up a little bit and to do a little bit off-road as well, because we know running on grass, on trails, even on track might just reduce the impact a little bit. So it's just being sensible about these things. And also when you mix up your training like that, you do get other benefits as well. Being off-road, you're involved a bit more balance, a bit more coordination. You're using a few different leg muscles and foot muscles.
And micro movements, isn't it?
So that there are benefits to that too. But I think, there is this big myth, isn't there, that running's going to wreck our joints.
Yeah, totally. As an anecdote, I always remember as a group of runners, we were, it was a club night, and I was going past this guy in the park, and he was walking with his dog and shouting after us, saying, "You're going to ruin your knees, you're going to ruin your knees." So it's really good to kind of get a bit more understanding around this.
The myth or the the statement that running ruins your knees is rife. You know, but it comes from a good place. It comes from people not wanting us to harm ourselves. It's often not the runners themselves. It's often the people at home or the non-runners who say, "Oh no, I won't do it because it wrecks my knees." And I think it's really, really important to be clear about this. I mean, there are some caveats, and those might be too much of a good thing. So we know that very elite endurance runners will have a slightly higher risk of damage to the knees. But for recreational runners and the kind of running that the majority of us are doing, it's not an issue. Yeah. Also, if you are someone who's had previous injuries, and we talked before about that affecting your biomechanics, putting a joint in a slightly different position to what it was designed for, that could potentially lead to you having an increased risk. Being very overweight also puts extra stress on the joints, so that we know that excess weight can sometimes increase your risk of developing osteoarthritis as well. And excessive miles and not looking after ourselves, inadequate recovery, all of those
fueling well enough.
All of those
diet.
factors can affect it. But the biggest one is genetics. Right. And interestingly, so the Faculty of Sports and Exercise Medicine, they have read a statement. And their statement says that exercise does not increase the risk of osteoarthritis. It doesn't cause it, and it can be used to help treat it and prevent it. Oh, right. So, you know, this isn't just stuff we're plucking out of the air. There's really good sound evidence for that.
Okay, so we shouldn't really be afraid then to go out running, listen to our bodies when they start to hurt, stop, you know, and then kind of restart again when everything's repaired. What you're saying really is when you get back on it too quickly because you've got an event in mind or a goal you're trying to achieve.
Yeah, definitely. It's all about it's boring being sensible, but you know, but it does. If you want, you know, we all want to be running, but we want to be running for a long time. You know, because we love it and we enjoy it. And the best way we can do that is to do everything in moderation and be sensible, but look at the whole picture and look at our training, look at our training plans, our strength and conditioning, our diet, our recovery, our sleep, all of those things sort of, they do help us to keep going for longer.
So what specifically is it in the diet that can affect, you know, your joints and your knees and, and your bones?
Two things I want to bring up there is making sure you've got the building blocks for the bones to be able to repair themselves. So things like calcium, vitamin D, protein, making sure you've got the building blocks for the muscles because the muscles are going to give a lot of protection to the joint. So again, looking at your protein in your diet. Right. But also an important one is making sure that you're actually eating enough because if you underfuel, you can push your body into what we call low energy availability. And you might have heard of REDS or RED-S, relative energy deficiency in sport. And that's when you're not consuming enough energy to fulfill and to supply the activities that you're doing. And then the body starts shutting down some of its other systems and functions.
I mean, that's a bit tricky as a runner because you've got these kind of two contradictory ideas. You've got this idea of if I weigh too much, then it's going to hurt more. And I'm not going to be able to run as fast or far. But on the other hand, I need to fuel correctly to give me the energy. They're very contradictory, those, or potentially. Yeah.
They can be, but I think it's often looking at the quality of what you eat and the nutrients that you're getting from the food, necessarily, rather than so much the sort of quantity of what you're having. Okay. But it's tempting to think that the quickest way to lose weight is to reduce the amount that you're having and to increase the exercise that you're doing.
Everyone knows about diets, for example, that, you know, miss out specific food groups as a way of losing weight.
Yeah, but if you do both of those things at once, you know, if you reduce what you're having and you increase what you're doing, it's quite easy to push your body into too much of a gap. Right. And so you've got quite a big gap in the energy that's available. And we know that can have a knock-on effect to lots of systems in the body, including to your bone health and your reproductive health. So particularly for women, but not just women, men as well. Right. If that energy availability is low for a long period of time and you do have RED-S, then that can affect your future bone health. For women, it can stop them having periods, which has a knock-on effect to bone health, and you can be at high risk of osteoporosis.
So will it change quickly if you reverse it? So if you start fueling properly, basically, does everything kind of click back into place within a matter of days, or does it take a lot longer?
For most recreational runners who are kind of up and down and not really much of an issue, it's fine.
Yeah.
If you have specifically got red S, then you need generally expert advice to make sure that your fuel is right and to get advice on how much exercise that you can do. If it's very, very minor, you may be able to continue training as you are, but just eat a bit more. But there are situations when the sports dietitian would say, actually, we need to cut back on your training for a while, or in very severe situations, stop it altogether. But it is an area which needs sort of expert advice. For most recreational runners, it's just trying to get a sensible balance between the two, really.
Okay, all right, well, that kind of makes sense. So just to kind of summarise kind of running and bone injury, kind of no, running doesn't cause knee injuries specifically. Obviously, you can get knee injuries from running, you know what I mean? But if you've got bad knees, it's not necessarily a bad thing to do because it can help. Is that kind of...
Yeah, I mean, that's very generalised. So it does, because we're talking about injuries and then something like osteoarthritis, which is a bit more of a sort of a medical condition.
Yeah,
but I think the overriding message is that as runners, running is generally good for our knees if we do it sensibly and if we avoid all those kind of caveats of not under-fueling and making sure we do the muscle strengthening and increase our training gradually and mix up our terrains, etc. Then running is good for our knees.
Okay, that is fantastic to hear. Thank you very much again. Great to talk to you, and we'll see you next time.
Thank you.
Cheers.